2019, Indonesia was shocked by the death of pigs due to African swine fever in North Sumatra province. And in 2020, the virus entered East Nusa Tenggara province, known as NTT, as the largest pig producing province in Indonesia. And until now, pig death has reached 500,000 due to African swine fever disease. This is a burden for NTT people where pigs have a socio-economic value, such as for traditional ceremony, including funerals and dowries. Timor Island, one of the largest islands in NTT, has direct borders with East Timor and share food product without strict quarantine. There was a speculation that African swine fever spread through food product from Indonesia to East Timor or vice versa. The situation can be worrisome for Australian government due to the mobilization of people from East Timor to Australia and then accidentally carrying viruses that attach to the personal belongings, such as boots. Based on this, the Undana team collaborated with Dr. Farhid Hematsadeh from the University of Adelaide, Australia, to detect the genotype that caused the outbreak in NTT, Indonesia. This research is sponsored by the Australian Centre for International Agricultural Research, ACIAR. By applying the whole genome sequence and phylogenetic tree, we found that genotype 2 was responsible for the outbreaks in NTT.
The samples for this study were obtained during the ASF outbreak in the Timor Island area from earlier 2023. Organ samples such as liver were collected from dead pigs that had previously displayed signs of fever, lack of appetite, and cyanosis of the extremities and earlobes, then usually followed by death within 3 until 5 days after exhibiting those clinical signs. The DNA from the organ sample was extracted. Subsequently, the ASF virus was detected using conventional PCR that utilized a primer pair targeting the ASF virus P72 gene. The DNA from the positive samples was later sent to Singapore for whole genome sequencing. The whole genome sequence was then analyzed using a bioinformatics system, including determining the genotype of the ASF virus using phylogenetic analysis of the ASF virus P72 gene. Finally, our study successfully confirmed the presence of the ASF virus as the cause of massive pig deaths earlier this year in numerous locations on the island. Furthermore, based on the phylogenetic analysis result, it was determined that the ASF virus circulated in the outbreak was ASF virus genotype 2, the same genotype as the earlier reported ASF virus from other parts of Indonesia, such as North Sumatra and West Java. Currently, this sequencing can be accessed on NCBI under the accession number PRGNA 983205.
Well, until now, no effective vaccine for ASF. Therefore, we need to do prevention by building people's awareness of how to cut the spread of this disease. However, we need to know the level of people knowledge about African swine fever, how they respond to the information about ASF, and how they practice good pig management to prevent African swine fever. Therefore, our second objective is to study the knowledge, attitude, and practice analysis of pig farmers toward African swine fever in NTT province.
With the help of ACIAR funding, we are able to conduct a knowledge, attitude, and practice study across East Nusa Tenggara province. KAP models is often used by researchers in the field of public health to explore people healthy behaviors. Therefore, this study mainly explores the relationship among participants' socio-demographic status, African swine fever knowledge, effective attitudes, and preventive behaviors. Respondents involved were 1,100 pig farmers from 22 districts in East Nusa Tenggara. A questionnaire is used to measure respondent knowledge, attitude, and practice regarding livestock management, swine health, new pig entry and biosecurity, pig slaughter and its products, breeding, and also African swine fever. Data from the questionnaire were analyzed using chi-square to measure the association between socio-demographic status, African swine fever knowledge, attitude, and preventive behaviors. The result of the KAP analysis showed that respondents from Sumba and Sabu and Timor and Rote Island with good knowledge of African swine fever have more positive attitudes toward African swine fever preventions and controlling means, and also have more better practice in preventing African swine fever. In addition, these positive attitudes influence farmers to carry out good practice for African swine fever prevention. While the results from Flores and other islands are unique, even though respondents from this area with good knowledge have more positive impact attitudes, their positive attitudes does not make them do better practice toward African swine fever prevention and controlling.
Universitas Nusa Cendana is a state university in NTT province, and it has contributed to the growth of NTT since its establishment. Undana, as a university with a global-oriented vision, is committed to providing solutions to local challenges via innovations and global networking. The ACIAR research grant exemplifies Undana's commitment to addressing local animal health issues through international networking, in this case with Australia being Indonesia's closest neighbor. This research award indirectly supports Undana's goal by enhancing the quality of researchers and research, which in turn has influence on the quality of education that Undana provides to the community. There are 13 program success indicators implemented at Undana, and at least 2 of them, international research and collaborations, are met by this research activity. Furthermore, the research output, specifically publications in respected international journals, would facilitate Undana to provide research results that are nationally recognized by the Science and Technology Indexing Journal, SINTA, in Indonesia. Last but not least, this research funding enables researchers at Undana and NTT to conduct research activities, particularly those with a molecular focus in the laboratory at Undana. As a result, it will support Undana in facilitating studies that benefit NTT and Indonesian needs.
The new skill that we gained was to set up conventional PCR from the scratch at our laboratory. The conventional PCR method was the first step to check the existence of the virus. Another skill being improved is problem-solving skill. As a principal investigator, my ability to manage time and coordinate team members have been increased, even in under pressure situation. This project really boosts our confidence as a young research from NTT, where this province is known for its poor quality of education. This is a big project for us as early career scientists. So completing this project requires commitment, communication, patience, and hard work. We have faced many challenges, both from within ourselves and from outside. The challenge from within ourselves was overthinking and worrying that we couldn't finish the project based on the due date. This made us burn out and even plan to give up. So the way we deal with this was to maintain a life balance between work, workouts, and rest. Moreover, we put in mind to finish the work bit by bit consistently rather than postpone the work and then finish the large quantity of work in a short time. The challenge from the outside was to coordinate many people getting involved in this project. For example, finding enumerators was challenging because they're really busy with their work or who did not want to continue their work for various reasons. To overcome this, we used the networking we have built before to help us find new enumerators.
The finding of this study can be utilized for monitoring the situation and development of ASF in NTT, particularly on Timor Island. The whole genome sequence has the potential to be used as vaccine seed for a homolog vaccine, a project we plan to develop. Furthermore, the DNA extraction acquired in this study can be archived for further ASF research in the future.
The result from this KAP study can be used to establish the baseline or reference value for use in the future assessment and help measure the effectiveness of health education activities, ability to change health-related behavior, and also suggest an intervention strategy that reflects specific local circumstances and the cultural factors that influence them, and plan activities that are suited to the respective populations involved.
As a principal investigator, I wish this is not only limited to research on African swine fever, but also other diseases that have the potential to cause death in a large number of livestock. With the skill that we gain, we can continue to determine the genotype of other disease virus in animal as a candidate of homolog vaccine. I hope this collaboration will be continued so that Undana laboratory can become a reference laboratory if there is an outbreak of a deadly animal disease. So, on behalf of team members, I just want to say thank you very much, ACIAR, for your support.